A very good morning to everyone. Thank you so much for sparing your Sunday at this moment for DentistChannel.Online. I'm welcoming to all participants and Dr. Khatib, our guest speaker. DentistChannel.Online is a amalgamation of dental practitioners, dental professionals, and dental industry, and all dental organization. It is for dentists, by dentists, and for growth of all dental professional and dental students. We have various services by Dental Channel Online, and which I'm going to introduce by this end of this webinar, and the benefits of Prime membership for Dentist Channel Online. So today's topic for webinar is mobile dental photography and overview by Dr. Khatib. Good morning, Dr. Khatib. Can you hear me?
Yes, ma'am, I can hear you.
Yes. So, Dr. Khatib, I would like to give a brief introduction regarding our guest speaker, Dr. Khatib. He is a BDS and MDS in conservative dentistry and endodontics. He has done BDS in 2015 and finished MDS in 2018. He is a private practitioner and simultaneously he is into academics also. He is a managing director at Crescent Dental Care and Dental Hospital, and a senior lecturer at the People's Dental College in Chhindwara in MP, Madhya Pradesh. He is working in Chhindwara and all surrounding areas in Madhya Pradesh. He is well versed with all kind of endodontic procedures, conservative dentistry, and his special interest is in dental photography. He has done diploma in dental photography, and his key role interest is in dental photography as well. So here I'm going to request Dr. Khatib for, without wasting any time, we can start with today's webinar, and he can give and he can provide us the best features and best his experiences and how to utilize for dental photography in private dental practice as well as professionally regarding the record of to keep the records of patients, and it will help legally also and to maintain records also. Dr. Khatib, can we start please?
Yes, ma'am, we can start. Thank you so much, ma'am, for a wonderful introduction.
Thank you.
Is it clear, ma'am? Screen?
Dr. Khatib, can you make it full screen, please?
It's full screen, ma'am, now.
Yes, it is full screen. You can continue. Thank you.
Okay, sir. Thank you. So, a very good morning to all. As today's lecture is about mobile dental photography. Is it clear? Am I audible?
Yes, sir.
Okay. So today's lecture is about mobile dental photography. So before we begin this lecture, I would like to begin this lecture with a question that which picture was taken from a smartphone? Is picture number 1 or picture number 2? That you have to guess that it is picture number 1 that is taken from a smartphone or DSLR, or picture number 2. So the answer will be revealed at the end of the lecture. So just a brief about photography. That do you know that the first digital photograph was taken in 1957 by Russell, and the early 2000 was the era of digital photography. And in the present day, most of the photographs are taken from a smartphone. I'm not here to criticize that dental mobile is best or DSLR is best. Definitely, they both have their own perspective. They both are good for photography. But in dental photography, I suggest that mobile play a very important role. And what I say that this power is in our pocket. But we always neglect, we think that no, we need expensive cameras, setup. Definitely, if you have that costly setup, you can take wonderful photography, but that does not mean that if you don't have that setups, you cannot take photographs. So the photograph you have taken earlier, these photographs taken without any setup, heavy equipment. So that's what I'm going to discuss here, and I'm going to tell you all these things. So why dental photography? Why it is important? The first question always comes in our mind, that why dental photography is important and why we need to learn dental photography and why is it so? The first thing is self-evaluation. Self-evaluation means suppose you have done any cosmetic work, either it's veneering or composite build-up or any dental treatment. So if you want to evaluate your work, you can take the picture, you can zoom the photograph, you can analyze where mistake you have done, where you can correct it, or which part has to be improvised. Definitely in patient mode, you cannot zoom it, you cannot analyze that. So the first thing is self-evaluation. Second comes the color of teeth. When it comes to shade matching, dental photography play a very important role. In dental photography, if you take a proper photograph, the shade mismatching problem can subside. So the color of teeth can match properly. Definitely documentation, you can document your work, you can save your work, and also you can present as educational purpose, like this lecture I'm presenting here. So same thing, you can present, you can record your cases, and you can present in journals or in articles or in some presentations like seminars, or in a conference you can present your cases if you properly record your case. Second, the next thing is protection. If patient sue you, if patient complain about you that you have not done the treatment properly, so you should have proper record to protect yourself. If you have proper record, so if patient sue you, you can protect yourself from medical legal cases. And marketing and for portfolio purpose. Here, I request all of you that kindly do not download someone else's cases from the website, from social media platforms. In social media platform like Facebook, Instagram, or Google, various photographs are available that you can download it and you can show it to patient. But that is not correct. Why is it so? Because suppose you have shown any case to patient and you claim that you can do such type of treatment, you can deliver such type of treatment, and if you fail to do so, the impact will be highly negative. So here I request you that if you are recording the cases, if you document cases, or if you want to show your cases, only show your case, do not show someone else's case to patients. In that way, you can motivate the patient have their own perspective that yeah, he or she can get this type of treatment. But if you share someone else's case and if you are unable to deliver, that going to put huge negative impact on your practice. Now, in a brief, that how does a DSLR capture a photo, or how does any smartphone, either is a smartphone, DSLR, mirrorless camera, how does it work? So in brief, you can see the picture that light enter through the lens and it hit the pentaprism. And in the pentaprism, light redirect to viewfinder. This concept works only in DSLR. And when shutter button is released, so this mirror lift up and the light hit the image sensor. But whereas in the mirrorless camera on a smartphone, light enter through the lens directly and it hit the sensor and image can be seen in electronic viewfinder. The second method is for all cameras, and the first method like pentaprism is only present in DSLR. Either you are using DSLR, a smartphone, or any camera, the concept is same. The light enters through the lens, it hit the sensor and image is captured. Now, when it's come to dental photography, what equipment are required? Definitely number one is camera, either it's DSLR or smartphone. I will be focusing on smartphones, and soon we are going to conduct the workshop that how you can take wonderful photograph through your smartphone. Whichever smartphone you are using, doesn't matter, either it's 100 megapixel, it's 12 megapixel, or whichever megapixel camera you are using, you can take wonderful photographs. Okay, so you need camera, lens, lighting setup. You should have at least basic lighting setup. But that does not mean you should have costly. Basic lighting setup also is sufficient for your basic photography. Then mirrors, contrasters, and retractors. Now, when we discuss about photography, and if you ask someone that which camera you should purchase, or someone asks you which camera you should purchase for photography, it is the same like question, which car is better? It's Mercedes or BMW. As a beginner, you can invest in any camera. I am serious. You can invest in any camera. You should not have to invest in heavy, costly camera. If you're interested in DSLR, definitely you can go for basic camera models, either it's Nikon, Canon, Sony, Olympus, or any company. All company provides wonderful cameras. Even if come for a smartphone, you can purchase any phone which have more than 12 megapixel camera. And in today's time, I think every mobile phone have more than 12 megapixel camera. So you can take wonderful photographs. If you have your iPhone or any smartphone Android company, I'm not here to like sponsor any mobile company. You can take whichever phone you are comfortable with. But what feature you should see when you purchase or when you invest in camera? Here I'm focusing on dental photography. When it's come for wildlife photography or street photography, that is different topic only at all, or macro photography. Okay, so in dental photography, the size, weight, shooting modes, and the type of sensor and the size of sensor matters. Size, type and size of sensor definitely not significantly affect, but yeah, the weight and the size of the camera, because if it's too heavy, it's difficult to take photographs. If you cannot hold for long time, you will get feel fatigue. So that's important thing. And the type of shooting modes what are available in camera, or it means custom settings, that's going to help. We are going to discuss all things in detail now. Now, when it's come to smartphone, definitely it's a wonderful equipment for dental photography, because smartphones are very important or has very good macro photography effect, and dental photography comes in macro photography. Definitely it is not good in a wildlife or sports photography. Some smartphones recently have upgraded to that also, but when it's come to macro photography or still photography, smartphone play a wonderful role, same like DSLR. So a brief about sensor, because earlier just we have discussed the sensor size matter a lot. Here two things we have to understand. First is pixel and second is sensor size. The bigger the sensor size, the picture quality definitely will be far better. That is true. So for example, in DSLR, the maximum pixel camera what we have seen is 20 to 25 megapixel camera. That's what we see in DSLR. But when it's come to smartphone, the pixel is 108 megapixel cameras are still available. But still, the 108 megapixel camera cannot replace the 25 megapixel DSLR. Why is it so? Because the sensor size of DSLR is quite big. So that play a significant role in quality of photographs. So here you can see, this is the picture, the type of sensors what are available, like medium format to full frame, APC crop sensor, and the last one you can see the smartphone sensor. Here you can see clearly the size of the smartphone sensor is 9 by 6 mm. In recently, some cameras have increased the size of sensor, like in iPhone and some other brand and Android, they have increased the size of sensor. When it's come to, and also now, second thing, why smartphones are not increasing the size of sensor? Because if you increase the size of sensor, the cost of the smartphone or the cost of the camera increase significantly. So the bigger the sensor size, the cost will be very much. Like full frame sensor camera is too costly compared to the smartphone. Definitely medium format camera is it's come in lakhs, in tens of lakh rupees. Now, here, like you can see here, we discuss about full frame, APS-C camera and smartphone. So what does it mean? What is full frame sensor? What is crop sensor? So for understand, you can see here the picture. The first one is actual scene. What you can see here. Here you can see the cursor. The first one is actual scene. Okay. So, and when you focus on the object, so this circle what you're seeing here, this is the light coming through the lens. Okay, so the first rectangle here, what you're seeing, this is light capture through the full frame sensor. And again, if the smaller size, light capture through the crop sensor. And if you go more smaller, the light capture through the smartphone sensor. In short, we are cropping the image. We are zooming and cropping the image. That's what does it mean. The full frame sensor, crop sensor, smartphone sensor means we are seeing the smaller portion of the actual scene. I hope it is clear till here. Now, this is the recommended custom shooting mode. If you're using DSLR or a smartphone, always set the correct date and time. change the color space to Adobe RBG. This you can change in smart DSLR, sorry. The image quality in RAW JPEG for Canon and NEF JPEG for Nikon. These two features only in DSLR. Then white balance should change to 5500 Kelvin, or it is daylight setting. Okay, and the ISO should be 100 to 200, and it should be auto single focus point. What are all these things we are going to discuss in detail in upcoming slides. Always focus on big five. What is big five? Aperture, shutter speed, depth of field, white balance, and ISO. What are these big five? Let's understand. Now, first is aperture. So aperture means, in a simple example, I will tell you. Suppose you are tired enough and you go to home and you lie down and it's a dark room. You're thinking about like in dentistry, you have done some mishap and patient is annoying you and you're thinking. And suddenly someone entered to the room and switch on the light. What you will do? You will put your hand on your eyes. So this is the same concept. Means the pupil dilate and constrict. The same concept work in DSLR or smartphone lens. Here we control the diameter of the lens. So if the larger the aperture size, the more light can enter. As you can see here, the larger the aperture size, the hole is bigger, so the more light can enter. The smaller the aperture size, the less lights can enter. Now here's the difference. If the aperture size is large, the depth of field will be shallow. And if aperture size is small, then depth of field will be deep. For example, here you can see in the first picture, the aperture is shallow. Aperture size is small. The f value is 2.8. That means the aperture is large. Large aperture means depth of field is shallow. Depth of field shallow means the less area can be focused. As you increase the f number value, what you can see here, f2.8, f4, f5.6, if you increase the number, you are increasing the depth of field. The more areas coming to the focus. So you have to adjust this aperture value. But sorry to say, the aperture cannot be controlled by smartphone. Recently, some smartphones and many iPhones have this feature. But in most of the smartphones, you cannot control the aperture. But the most important aspect for photography and dental photography is aperture value, the f value. Okay, so basically, if you're using DSLR, so these are the some parameter I will recommend that if you're using taking intraoral photograph, the aperture value should be f22 to f29. If close up, then aperture value should be f16 to f18, and for portrait, the value should be f10 to f30. This should be the aperture value when you're using DSLR. Definitely, if you're using a smartphone, you cannot control the aperture value, but again, it is so well integrated that it will focus and you will get proper depth of field with a smartphone. Now, next is exposure time. This you can control through a smartphone, but again, the exposure time or the shutter speed have very less impact on dental photography. Why? Because there is no motion. The objects are still. The objects are not moving. So definitely it is not significantly important. But again, the what should be the at least shutter speed. If you're using dental photography, the shutter speed should be at least 1/100 or 1/200 at least. I mean 1/100 to 1/250. It should be in between two range. If you increase the shutter speed, that means if you increase the denominator value like suppose 1/8000 or 1/20,000, that means you are controlling the motion. Increasing the shutter speed, as you can see here, you can control the motion. If you're decreasing the shutter speed, that means you will get the blur image. What you see in the night light photography, that long light effects are coming, that is you are decreasing the shutter speed. You're controlling the shutter so that you can get the light effect. Definitely, it has significant impact on wildlife photography, especially and sports photography. The shutter speed, as you can see in this picture is taken through the DSLR, not through a smartphone. Just want to show you the amount of aerosol production. So this is this shutter speed was 1/4000, means 4000th part of 1 second this picture has been clicked. So this is how shutter speed works. Now, as we have discussed about depth of field. So what is the depth of field? It is that, like what I said earlier, depth of field. Shallow depth of field means less areas in focus. Deep depth of field means more areas in focus. As you can see here, the distance between closest and the furthest thing in your photo is the depth of field. For example, here it is narrow depth of field. You can see that very less areas in focus. Where it is deep depth of field means much areas in focus. You can see till last color of pencil. This is what depth of field means. So why it is important in dental photography? As I told you, the aperture value play a significant role in dental photography, and aperture value control the depth of field. So how it is important? So here it is always follow the rule of 1/3 and 2/3. What is rule of 1/3 and 2/3? The area it is in focus, the point where you're going to focus in the dental photography, in that 1/3 anterior and 2/3 posterior should be in focus. That is important. That is most important. This I want to all of you to focus and understand the rule of 1/3 and 2/3, that in focal plane, the area where you're focusing, the point where you're going to click, that this part I'm going to focus. So 1/3 anterior and 2/3 posterior of it should be in focus, so that you will get clear image about the region what you want. For example, if you are for example, if you're using in next slide I will tell you. For example, if you're focusing on intraoral photograph, so always focus on canine. As you can see here, if you're focusing on canine, so 1/3 anterior and 2/3 posterior will be in focus. Suppose if you focus on central incisor, so maximum area you can see in focus is canine. You will not able to appreciate molar. So this is what rule of 1/3 and 2/3. Always remember rule of 1/3 and 2/3 when you're taking intraoral photograph. I hope it is clear. Now, white balance. So what is white balance? White balance means the color of light, or the temperature of light. And if you see if you're taking photograph in daylight, in afternoon, the photo is more bluish. If you take the photograph in near bonfire, so it's more orange. This is what the daylight setting or white balance is. For the dental photography, the recommended temperature is 5500 Kelvin. That is daylight temperature mode. In that temperature, this feature is available in almost all smartphones, that white balance. You can open the pro mode or custom mode where you can see the white balance setting, and this should be 5500 Kelvin. And definitely the current what light we are going to discuss, the flashlight is coming, that is integrated to 5500 Kelvin, means daylight setting. So you can take photographs, so shade matching won't be a big issue. Here you can see that this all picture, and this picture is taken in different mode, like tungsten, fluorescence, flash. So this is a different light mode which is available. Here, for example, you can see if you take a picture in 5500 Kelvin and if you change the temperature, this is how the shade works. Here, just I want to show that I'm using a ring flash. So how does it going to affect the lecture? You can see here. Yes, you can see this. As I'm changing the temperature, you can see that effect, it changing the shade or changing the photographs. So this is important. So for dental photography, temperature should be 5500 Kelvin. And currently the smartphone or DSLR are integrated to this temperature. If you want to change, you have to go to the custom mode. It's already auto white balance, means it is integrated to 5500 Kelvin camera setting. Now, next is ISO. ISO means the sensitivity to sensor, what we discussed. The sensor will be sensitive to lights. So this is more significant when it's come for night photography or like sky photography, astrophotography. For dental photography, the sensor, the ISO value should be 100 to 200, not more than that. What will happen if you increase the ISO value? If you increase the ISO value, the sensor will be more sensitive to light. So it will try to capture more and more light, but the drawback is the picture will be more grainy. But when you take a night photography, it is not significantly affect. But in dental photography, it affects a lot. For example, here you can see the first photograph is taken in optimal light with low ISO. And the second photograph is taken with low light in a high ISO. You can see clearly here its picture more noise or more sharpness present compared to the first photograph. So this is what ISO affects. If you increase the ISO, the light will enter more, but image will be more noisy. This is the problem. But for dental photography, we have sufficient amount of light. So the ISO between 100 to 200 is sufficient. Now next come to histogram, not Instagram, it is histogram. Histogram represent the actual photographs. This is very important. In many smartphones, this setting is available. When you take photo in pro mode, histogram option will pop up. So what is histogram? Histogram is a x and y axis. The zero part, what you can see in the two left part, it is show black, and the right part is show two white. So if the histogram showing like this, if it's towards too left, that means your picture is too dark. If your histogram is near too right, that means your picture is too bright. The light is more. So you have to control that. That does not mean that in other photography also we have to balance the histogram. Suppose if you're taking black photography or two white photographies, that means then histogram play a role, and we can understand that two black means you want that type of photograph. For example, to understand in a better perspective, you click a photograph. When you see in the mobile phone, you feel, wow, it is very good photograph. But when you print out, when you see in the when you upload it, you see, no, this is not that actually look like. Why? Because LED light or brightness put effect on your photograph. So the actual photograph you can understand by reading the histogram. So too left means it is too dark, and too right means it is too bright. This is a way to understand histogram. So here to understand, you can see the first picture, it is too, histogram is towards too right. That means overexposed, means brightness is too much in a simple way. In the last one, it is underexposed, means it is towards too left. You can see here, it is dark photography. But again, these concepts work when you're taking standard dental photograph. When you're going for creative photography, I will recommend go crazy. You be creative, try to understand histogram and take a photograph in different light condition. That is different when you come when I'm talking about creative photography. But when it's discussing about dental photography for documentation purpose, we should focus on histogram. When is the desired exposure, what we want, then only we can understand proper shade match or proper documentation what we want to do. I hope it is clear, the histogram part. Now, this is an important camera setting. What you should have, the aperture value should be f22 to f36 for your dental photography. Or shutter speed should not be more than shutter speed should not be more than 1/250. ISO should be 100 to 200, and always use flash. We are going to discuss that part about flash also soon. So these are the more few dials available in dental, in DSLR. Just a brief. In auto mode, you can see in DSLR, that means camera control everything. If you're using DSLR, then come to shutter priority mode. That means you can control the shutter speed. Rest, the other setting can be controlled by the DSLR. Aperture, if you're using DSLR, aperture, try to take photograph from in aperture priority mode as a beginner. So you can control the aperture, rest other setting can be controlled by the DSLR. And then manual mode, you have pro, you can control the all setting like it's aperture, ISO, or shutter speed, or anything you can control by yourself. These are other modes that is available like macro mode, sports mode, portrait mode. In DSLR you can see it. In brief, I just want to tell you that. Now, when it comes to lens, which lens is important, that is always a part of discussion. I'm covering both aspects here, DSLR and smartphone. When it comes to lens, and definitely when it's come for dental photography, the lens we want, that is macro lens with a magnification ratio of 1:1. So what is this magnification ratio 1:1? We are going to discuss. So always focus on focal length, magnification ratio. It should have image stabilization and lens speed. Now you can ask this question that in mobile, how we can see that? So the best part is in mobile, you don't want all this extra feature. It's already inbuilt. This all features already inbuilt in mobile. Okay. So here you can understand for magnification ratio, you can see this picture. 1:1. The first number here in the ratio represent how big the object appear on your camera sensor. And the second number represent how large it is in real life. Understood? So 1:2 means the object is half in size, what we can see in the camera. Now 5:1 means the object appear 5 times bigger in image sensor compared to the real life. This is what magnification ratio is. So for dental photography, you need the camera lens, which is a magnification ratio of 1:1 for DSLR. But for mobile phone, you don't need this. Already your camera, a smartphone have such good features. Okay. Now, when it's come to flash, it's like ring flash, dual flash. Here, I just want to tell you, these are the type of flashes which is available in a market for mobile also. If you think that for only DSLR only we have this type of flash, either ring flash, dual flash, strobe, or speed light. What are these? I will tell you now. When it's come to ring flash, it is same like this, and it is attached to the DSLR, or this type of ring flash you can attach to your smartphone and you can take photograph. The problem associated with the ring flash is that it focuses more on center. So it is good when you're doing surgical photography, like it's periapical surgery or jaw surgery. If you want to document, then ring flashes take a very good part. But it is not good when you're doing shade matching, because the light is more focused on central. So the central appear more bright compared to the other teeth. Okay. So for that purpose, for prosthetic purpose, you need dual flash. Okay. Dual flash is very important when it's come for prosthetic photography. Dual flash just work like this. Okay, for mobile also it is available. Now, next is strobe. The strobe is very heavy and costly equipment. You cannot move strobe. It has very high light, and you can see this all in photo studio. And then comes speed light. Speed light is one of the advantages, I will say, of one of the best device which is come in market. If you can afford flashlight, I will recommend you to invest in speed light, because speed light you can move, you can put somewhere else in different area, and you can take a wonderful photographs. And I can show you that all. Now, next is what equipment is required apart from lens and flash in dental photography. The next one is contraster. You should have proper contraster, that's black contraster. When we are going to do workshop, we are going to discuss this, how to use this contraster in patient mouth. We are going to discuss all things that how to use flash in mobile, how to use flash, and in DSLR, how to use flash, and use of contraster and mirrors, how to use in the upcoming workshop. Very soon we are going to discuss that. So in the best part of contraster is you can get Photoshop free background. Here you can see this. This is a picture is taken by contraster. So you can get the proper background, and this black part absorb the light and does not reflect on the two. So the glossy part will not be there on the two surface. You can understand your work, you can see the detailing beautifully, you can analyze your work properly. Now, next thing is again important is cheek retractor. Various type of cheek retractor available, type C cheek retractor or self cheek retractor. I will recommend you to use black cheek retractor. You will get beautiful impact on your photography. You can use transparent cheek retractor also, but to give beautiful impact, try to use black gloves and black contraster. It will give wonderful result on your photography. Now come for mirror. Two type of mirrors are available: front surface and back surface mirror. What is front surface mirror? The light reflect from the front surface. The back surface mirror means the light reflect from the back surface. The problem associated with front surface mirror is it is too costly. I will recommend, like, it is come around 6,000 to 8,000 rupees, this front surface mirror. But back surface mirror you will get in below 1,000 rupees. The problem with back surface mirror is, back coating surface mirror is, you will get dual image. That is a problem. So if you can invest in front surface mirror. Always keep them in hot water and spray while during the process, and clean with liquid. So do not rub it, otherwise you will get a scratch. Now, when it's come to intraoral photography, how we have discussed already that you have to follow the rule of 1/3 and 2/3. You should focus on canine. Then what other thing you should keep in mind? Now, when you're taking intraoral photography, the camera should be parallel to the patient mouth. Patient come with different height, so do not take photograph when patient is standing position, because the camera position will be either too low or too up or too right or too left. Make the patient sit, then you sit comfortably, and the patient mouth, patient face and the camera mouth should be in the parallel position. This is the mode you have to take photograph in parallel position, in lip repose, relaxed smile, full smile, then closer shot of all this, full dentition with retractor, maxillary anterior 6 to 8 teeth, maxillary anterior 6 to 8 with contraster and shade evaluation photo. These are the photographs for documentation is required. You should take so you can analyze your work, especially in the cosmetic or dentistry, or when it's come for shade matching or for anterior veneer cases. Okay. Now, how to position a contraster? You should not place the contraster touching the molar teeth because the contraster should not be too low. When you place the contraster should be parallel to the tooth surface, as you can see in this picture. So you can take a wonderful photograph. If your contraster is too low, you will get that ghost effect or shadow effect in your photograph, and photograph does not appear good as what you want in Photoshop free background. Definitely you can edit your photograph later on, but it's a big hectic. Why you want to edit when you can take a perfect photograph with contrast in the same manner? Okay. Now, when it's come to camera positioning, always position the camera. Sorry, my mistake. When it's come to mirror positioning, always position the mirror and it should not touch the tooth. For example, if you're taking the upper arch photographs, so the mirror should be placed at lower region, and the mirror should not touch the molar. In a simple word, your intraoral mirror should not touch the posterior region. There should be some gap between your teeth and the mirror. Then only you can take a perfect photograph, and the angle should be 45 degrees. That is most important. Either you take from front or from the back of the patient, but angle should be 45 degrees. That is very important. That you should keep in mind. And mirror should not touch the teeth. There should be some gap between the teeth arch, upper arch, and the mirror. Same come for the lower. The angle should be 45 degrees, and the mirror should not touch the lower teeth. When it's come for a side photography or like lateral photography, there's two options. Tell the patient to retract the cheek with a cheek retractor and take the photograph, or if you have mirror, place the mirror or tell the assistant to place the mirror and you take from opposite side, photograph from opposite side, and angle should be again 45 degree. That's what is more important. The angle is always 45 degree, and you always use flash. Now, this is a basic rule for perspective symmetry in dental photography. The camera Y should be at parallel level, because if it's from 2 up, the teeth will look longer. If it's from 2 down, the teeth will look shorter. If it's from left or right, the respective region appear much broader, wider. Okay. And again, for intraoral picture, always crop the image. Okay, the beard, the mustache, or this nose part should not be seen for intraoral photograph. I'm not talking about here creative photography again. This is just for your documentation. Okay, and always use adequate cheek retractor and contraster for your photographs. Now, when it's come for portrait photography, as we discuss about type of flash like ring flash, dual flash, speed light, and strobe, you can see a classic example. When it's seen that, if you see the first picture taken from ring flash, this part, look here, lights are more. The light impacts are more in the face, and the rest part is much darker. This is a problem associated with ring flash, or what you can use with mobile, this type of ring flash. Okay. Now, when it's come for dual flash, this can be used for portrait photography. If you cannot afford speed light and strobe, because that is come for DSLR photography, that we'll discuss in some other part when we are discussing about DSLR photography. But if you're using mobile, you can use ring flash or dual flash for your portrait photography. Now, this is how you should place a flash when you're taking portrait photography. There should be 3 flashlight at least, 2 at 45 degree angle here at this region and 1 at the back. This is what speed light, how it's work. But if you don't have flash in this type of flash, so what you can use this type of lights and tell the assistant that hold the paper in front of it, so it will act as a diffuser. Okay, and then you can take such a wonderful photographs. I hope it is clear till here. Now, when it's come for closer photography or it's a creative photography, there is no rule. But try to avoid glossy makeup, like you can see in this picture, because it reflects in photography, it will give more glossy appearance. They use matted lipstick and then take a photographs. In creative photography, there's no rule. You can see on Instagram and social media platform, people are putting aesthetic photograph with the wonderful cases. But what I'm telling you here, you can take these all photograph like these two pictures taken from a smartphone. So you can take all this photograph through a smartphone. You don't need any heavy equipment. Just you need a piece of paper and a flashlight to act as a diffuser and an assistant that can hold it, and you can take a wonderful photograph. You have to be creative photograph. Okay, now when it's come for laboratory or for shade matching, the most important here is you at least take 3 photographs. If you cannot take polarized photograph, take a normal photograph, then high contrast and low brightness photograph, and black and white photograph. If you have cross polarizing filter that is available very economical price on Amazon, polarizing filter, that is very important for shade matching. What polarized filter will do, it remove the glossy part so you can properly match the shade. So in a cross, if you can afford cross polarizing filter, that is best, no doubt at all. So cross polarizing filter, remove the gloss, take a photograph with this, then take a normal photograph, and then take a black and white photograph, and then give it to lab. So the lab communication will be very, very much easier for you. And again, most important, the shade mismatching problem will be decreased. It won't be a big issue for you. Now, this is a cross polarization and creative photography. This picture is the picture of, I'll tell you, the closer view of curing light. So this is what? This is creative photography and cross polarizing photography. What I'm here to tell you and what I'm here to show you that you can take wonderful picture just through your smartphone. You don't need any heavy equipment. You don't need any costly equipment to take wonderful photographs, either when it's come for patient photography or when it's come for creative photography. You just need a smartphone and a patient. Simple thing. One more thing I forgot to tell you, when you are taking portrait photography, kindly do not take on dental chair. It does not appear good. Make the patient sit and the background should be white or black, and then take a photograph. That's what you should focus on. Portrait photography. That's one point I forgot to mention last. That's why. Then the software what I recommended here is Lightroom, PixArt, and Snapseed. These are the basic software that you can use. You can edit and modify your photograph wonderfully. Okay, it is available in Play Store free of cost. Now, coming to the last slide. This picture, both pictures was taken from a smartphone. So what I just want to tell you, the power is in your pocket. You can take a wonderful picture through your smartphone. At the end, I would like to conclude by saying just keep clicking. Anyone can click wonderful photographs. I hope you understand what I try to explain you here about mobile photography, and now you guys can take or you guys try to click wonderful photographs. Thank you.
Thank you so much, Dr. Khatib. That was wonderful explanation regarding the technical part and practical point of view. What is the importance and how to proceed with for dental photography, for betterment of dental practice regarding the documentation, regarding clinical aspects, and any other things. We will take question and answer session after 5 minutes. By the time I will just brief regarding DentistChannel.Online. Just give me 5 minutes, everyone. So DentistChannel.Online, it is a amalgamation of academic, professional, commercial needs of dental students, practitioner, organization, all dental industries, and all professional dental leaders, all under one roof. We provide different kind of services. It is divided into the 2 portions for dental professional and dental students and dental organization. We keeps on updating dental news. We have done a lot of 700 plus dental webinars. Earlier, due to pandemic, COVID was there, so we have done only online courses and workshops. Now, slowly and gradually, offline courses and workshops are going to be there. in all over India and all over the country. Continuously, dental events will be updated in the broadcast group. Premium videos will be there. And another important aspect for all Prime members, they can take advantages of recently or updated dental events. There will be a broadcast group will be created, and they'll get a Prime membership, and the certification will be done from the internationally accredited, and CD points will be given to the participants. IT services will be given by the DentistChannel.Online. They can, it includes the web designing, graphic designing, and promotion through the social media, and everything will be done by the dentist, so that all the updation and events management will be done by the dentist. So it is a very ethical work which is delivered to the dental professionals and dental organization. Dental business is also included. Or the dental companies or a dentist, they can buy and then they can sell their products through the DentistChannel.Online. The videos will be given to the Prime members, and then they can see the recorded videos anytime and anywhere, because most of the time maybe participants or we all are busy. If we are not able to see on time, we are not able to attend the videos or webinars, then they can see the videos. Another point is the graphic designing will be done for the private dental practitioner if they want to promote or they want to give promotion regarding the clinic or the patient related treatments. The all kind of promotion will be done through the dentist channel. As we all know, 700 plus live or dental webinars is done, dental workshop has been done. The participation certificate will be given, and another campaign was going on for the Save the Tooth, and 300 plus YouTube channel videos are available under the campaigning of the SaveTheTooth.com. We have national speakers, international speakers, all latest topics in the dentistry like implants, basal implants, and many more other topics which is included through the DentistChannel.Online. The certificate will be provided to the all participants, to the speaker also and to the participants, and it will be included into the overall dental students and dental practitioner. And I'm happy to inform that or to announce that the DentistChannel.Online is entered in the India Book of the Records for the maximum speakers participating in the virtual conference in the oral implantology. As I've already discussed regarding the Prime membership, we can see a personalized account in the dentist channel will be there. They can access all the webinars. The certification will be done by the recognized institute, and which will be increase the CPD and CD point. They can download the certificates. You can see your profile anytime. Regular updates, participation of all kind of well-known speakers will be there. This type of certificate, certificate of participation, will be given to all participants, and it is accredited by the Federal Dental Association from the Finland, Germany, and with the 1 CD point with each certificate will be given to the participants. So it is 799 rupees per year, and when you use promo code MS100, definitely you will get a discount. So participation of webinar, you'll get platform to interact with the all experts, all dental professional for a year long, for complete 1 year. It is continue dental education will be given to all the dental professional and dental students. All news and updates will be given to the all Prime members. Here we have upcoming webinars will be there from 15th to the 15th April and 17th April, and regular updates will be given into the broadcast group. We are following all the social media channels, that is Facebook, Twitter, Instagram, LinkedIn, YouTube, WhatsApp, and Telegram. The DentistChannel.Online is associated with all kind of social media. Thank you so much. And now we'll start with the questionnaire session. Yes, Dr. Khatib, Dr. Vaibhav's question is twin flash for a mobile brand. Which all twin flash can be used for the mobile?
For twin flash, actually there's such brands are currently not able for mobile photography, but there's two websites which are providing twin flash. One is APEXL website and second is M10 and .in. If you see our Indian macro lens, these two websites where you can take this twin flash, you can purchase it and it's a customized twin flash you can use for mobile dental photography.
Okay.
Otherwise, the second technique I'll recommend is ring flash. What you can use two ring flash, and you can someone tell your assistant to hold it at 45 degree. It will give almost same impact like twin flash.
Okay, okay. Yeah, thank you so much. And I would like, yes, one more question is there. Which DSLR camera is the best?
Again, this is same question everyone asks as a beginner. You can use any DSLR camera. Any company, either Nikon, Canon, any camera, either crop sensor, full frame sensor. As a beginner, I will recommend do not invest in costly cameras. Okay, if you want to learn photography, there's two options. DSLR cameras are available for rental purpose also. Simple way, in a cities you can use, take, and you can practice and you can learn. If you think you're a master, then take a camera, any either is D3500, Nikon, or is Canon, any brand, whichever you want to use. There's no rule or there's no criteria. You can use any specific DSLR. All DSLR have wonderful photographs. Sony have one good quality, that Sony camera have good crispy image compared to Nikon and Canon, but it's very not significant difference. But yeah, Sony have some wonderful, but the Sony camera come with cost also.
Okay, and how diffuser is used for a ring flash?
Simple. Use a piece of paper. Use a piece of paper in front of diffuser. Place a piece of paper here and put a ring flash at a bit distance. It will act as a diffuser. This is a customized diffuser, or what we'll say in our Indian language, UART diffuser. You can use it for dental photography.
Okay.
Piece of paper or tissue paper is sufficient. You place in front of flash, and there should be some distance, and you can use it as a diffuser.
Okay. So there is any setting in the phone camera are to be changed every time when we are clicking a photo?
No, there is no camera setting you should change. But yeah, if you want to take a photograph in a pro mode, in a custom mode, then the white balance setting you should change to 5500 Kelvin and always use flash when you're doing dental photography.
Okay. Does the color of room, lighting, etc. have major effect in the final result?
Definitely, not major, but yeah, significantly effect on the dental photography. Especially, it's come when you're talking about shade matching. So when you're taking the photograph for shade matching, do not wear the clothes which are more reflective or is too bright, or like tell the patient to use lipstick or glossy thing, because it definitely reflect and put effect on shade of the teeth. That's why it is recommended to take a photograph in 4 different modes, which using by cross polarizing filter, then normal mode, then high contrast mode, and black and white. So the in lab communication, you can tell properly which shade you can use. And also when using shade matching, try to use cross polarizing filter lens, then take a photograph, and so you can understand proper shade match. And that same way, the like you're saying, the room color or the color of clothes and the lipstick affect the shade of the teeth.
Okay, okay. Thank you so much. And definitely, I think Dr. Khatib will explain more in detail practically when he is conducting his workshop with our Dentist Channel Online. So practical knowledge is much better than the theoretical knowledge. So I think that would be a very good option. Yeah, and thank you so much from all the participants.
Thank you so much.
For a great information in this webinar. It was very much helpful to all our participants. Thank you so much for sharing your knowledge to all our participants.
Most welcome.
It was a very much informative.
Maybe my participant might have felt that it's very boring technical, but I'm sure when it's come for that I will just always say now my lecture that power is in your pocket. Just take your camera and start clicking. You will take wonderful results in.
Yes. It is really, I completely agree with you, Dr. Khatib. So any other questions? I am requesting to all participants. Then questions are most welcome so that we can answer all your queries regarding the webinar. So Dr. Khatib, just one small question from my side. Like, briefly, what all say other accessories are required for a mobile photography?
For mobile photography, recommended list like basic one flash, ring flash, contraster, and cheek retractor, and mirror.
Okay.
This is
okay.
But when it's come for creative photography, again, that's up to your creativity. You think whichever.
Yes, that is true.
Flash is recommended when it's come for creative photography. Without flash, because if there's no light, there's no photograph. So light is very important.
Okay, yeah, thank you so much, and definitely we will see you in your workshop, and give us your valuable time for workshop, and gradually the participants and all dental professionals should use the dental photography, mobile dental photography for their betterment. Thank you so much.
I recommend and I request the participant, those who are interested in workshop, if it's possible for them, if they can bring bring accessories along with them, like contraster, mirror, cheek retractor. I am sure many of them might be using that.
Yes.
With that, a jaw set, because definitely if they want to learn how to use on patient, so either they should have an assistant
practically.
Jaw set, what we all use type of jaw set in our second year preclinical dentistry. If they have, we can show it better that how they can use these things in patient mouth. Okay.
So few things what you have recommended for the participants should be having these all kind of accessories.
This flash, it's okay, but other they can use, so bring that, it will be more easy, and it's very economical also.
Okay, that's a great idea. Okay, thank you so much. So here I ending this today's webinar, and thank you so much for your time, and thank you so much for all participants for giving us time on this your valuable Sunday. Hope to see you soon all again with the Dentist Channel, and I'm thankful to you all from Dentist Channel.Online, and I would like to see all the Prime members soon with our next webinar. Thank you so much.
Thank you so much.
Yeah, good afternoon.
Good afternoon.